Hello. Hi, everyone.
Hi,
Exciting,
everyone.
expecting a good group tonight. Please answer the poll, the intro poll that should pop up on your screen right now. Allows us to learn a little bit more about who we have here, in addition to entering you into our giveaway at the end that we'll raffle off. So just make sure you stick until the end because we will choose someone else if you don't, or if you're not active in the chat.
And definitely be active in the chat throughout. This is we're open books. So ask any questions you have. Sometimes we'll answer them like right when we see them. Other times we'll answer them down the line. And I think a lot of us have a couple screens going. So if you see us looking away, we're not answering emails. We're answering your questions in the chat.
Yep. There's also a Q&A feature at the bottom. Feel free to use that to put in your questions so we can keep track of them. And then, yeah, also use the chat. Tell us, where you're from, where are you at now, and which board exam are you studying for? What's your upcoming one?
That last question's the important one. That's the stressful one.
Yeah. And while you guys
Oh, sorry. Yeah, just make sure you're responding to everybody so we can all see what questions we're asking.
So switch it from host and panelist when you respond in the chat to everyone if you're comfortable doing that. We got a lot of step ones, a lot of step twos, people from all over.
Welcome.
A lot of step ones. Wow.
Oh, wow, we got a lot.
Step 3, complex. Yeah. This is going to be a really useful webinar, folks. This is going to be great.
Oh, I see a Guatemala. This is cool. Canada.
I think we have half the world represented here. This is incredible. You guys are from all over.
Studying for life. That is relatable.
I am.
Hey, I got a fellow New Jersey folk out here. That's great. I'm in Central Jersey. Welcome. We're just going to get started in a couple seconds here, folks. Thanks everyone for being engaged in the chat. It makes our lives this makes it more fun.
Yeah, agreed.
Yeah.
All right, I unfortunately wasn't able to live stream, as I think there's some internal errors, but we do have the recording going, so we will post it on YouTube, and then also we'll share this out as a recording in our post-event email. So definitely look forward to that. But yeah, we can get started. So Pooja, are you able to maximize the screen here? Yeah, perfect. And then slideshow if possible, so we can maximize everything.
Okay.
Perfect.
Does that look good?
All right.
Cool.
Yes, this is perfect. Well, thanks everyone for joining us tonight. Just a kind of a brief introduction. We're going to be doing a bunch of different things. But my name is Jin. I'm on the marketing team at Sketchy, so we'll be kind of moving things along. But really, the two spotlights are Pooja and Camden here. So definitely want to pass the ball to you guys to give a brief intro on who you are.
Yeah, so hi everybody, my name is Pooja. I am a creative content developer here at Sketchy. A little bit of background on me. I actually did my pre-med at MIT, and then I went on to do my medical degree alongside a master's in biomed engineering at Columbia. Around right after my clinical year, I decided I would much rather be making cartoons to help you guys learn instead. So that's how I ended up here, and I'm super excited to be here.
And hey folks, I'm Camden. I'm almost done with 4th year. I have one more week. I'm a senior USMLE tutor at Blueprint. I've been doing it for since 2020, tutoring step 1, step 2, complex, everything in between, shelf exams. I did my undergrad at Emory. I started my med school career in 2015, actually. So it's been 9 years because I stopped for a little bit and I did a research PhD and a postdoc at Princeton University in neuroscience. I'm heading off to residency next year. I'll be doing a transitional year at Rutgers, and then I'm going to be heading down to Johns Hopkins for interventional radiology. So super excited. This is something I'm very passionate about, and so I'm pumped for this webinar.
Great, thank you. Let's kick things off. So we have a great agenda for you guys. So we'll do a brief intro for the 20% of you guys who do not probably maybe not know what Sketchy is, or maybe know but haven't used Sketchy yet. And then also Blueprint here, our partner. We're gonna dive into some study strategies that Camden and Pooja have gone through, and some things they wish they could have had now that if they could do it again. And then after that, Camden's going to walk us through 3 different board style questions, one for step 1, step 2, and shelf. So that's going to be really exciting. So ask all your questions there. And then lastly, if you stay until the end, we have a really special discount for Sketchy and also a giveaway for a Blueprint 2-hour tutoring session, in addition to a 3-month Sketchy subscription. So we'll begin really quickly, run through some of the intros. So if you don't know who we are, we're Sketchy. We do visual learning. We turn all of the medical concepts that you need to learn for medical school into visual stories that are engaging and narrated. We believe that our lessons take a more enjoyable approach to studying, and we're proven to help save you some time and increase retention, help you memorize those pesky medical concepts. And then next slide, we do have a full curriculum. So we have one program that spans content across all 4 years. We're working on some really exciting upgrades within our clinical curriculum that's going to launch later this summer. So definitely keep your eyes peeled for that. But that is really who we are. We're super excited to be hosting this, and we'll pass it over to Camden for a quick intro on Blueprint.
Definitely, and thanks for having me on the webinar, guys. So for anyone who's not familiar with Blueprint Med, I just want to give a really brief intro. Basically, we're kind of we're one-on-one tutoring at heart. It's a bunch of us who have gone through med school ourselves, taken the same exams. We understand the troubles and the trials and the tribulations of this process. And we're basically here to give you personalized tutoring. That's the meat and potatoes of what we do. You meet with folks like myself, and we work all the way, for many, many hours preparing for step 1, step 2, and any exam in between, even coursework. But I did want to emphasize that we also have some free resources that you can check out. One of them, if you just go to Blueprint Med and on Google, you search for the free med school study planner, super useful kind of AI-driven study planner that takes a lot of the hours that you spend making a study schedule kind of out of the equation and builds a study plan for you based off of your requirements. So definitely check that out. And then on the other side, we also create practice test banks. So for example, for step 2 in shelves, we have a bunch of practice questions. I think it's like 5,000. Yeah, per the slide, there's about 5,000 questions in total. Really great resource for you to check out, particularly for your shelf exams. And let's go and click through the animations on this slide, because last little kind of pitch here, but this is something I'm really excited about because I help put it together with the rest of the whole Blueprint team. And that is that we actually just released a completely full-length step 1 practice exam. A lot of you folks out there look like you're preparing for step 1. This is a complete whole 8-hour exam with analytics. You can even reach out to the team that created the questions and talk to those physicians over email. And I'll put this in the chat in a little bit. Right now, it's really, really cheap or even free. I think if you try this code, it's like $15 if you don't use the code for the next 2 weeks. And the reason I say that is because on May 15th, I'm actually hosting a workshop to go through the questions that people are getting wrong on this exam most frequently. So anyone who takes the exam over the next 2 weeks, on May 15th, Blueprint's going to host a webinar that we will dive deep into these questions and help you basically figure out where you are and how you stand relative to your peers, and really talk through the material and how to prepare for step one. So definitely check this out, and I'm going to throw some links in the chat as well. Oh, and then if you wait till the end, there's some tutoring free promos to wait for.
All right, we'll get right into it.
Awesome. So yeah, we're kind of flying through this first part because we've got some practice questions I want to talk through, but this is a general strategy. So we're all taking different exams. Step one, complex, all of those. Step two, step three, even I saw a few folks. And there are some strategies that by and large, for 95% of the population, are really the best way that you want to approach these exams, whether or not you're still doing your clerkships or you're doing your pre-clerkship work. And one of the very first things is that for every exam that you're taking, say that you have a shelf exam and you have an 8-week clerkship, the very first thing you need to do is you need to figure out what your resources are. And what I like to say is that you need an encyclopedia resource, so that's something like first aid. You need a active recall resource, so something like practice questions, so UWorld, Roche Review, Amboss. UWorld is still the gold standard here. Then you need a retention tool. So retention tool is going to be something like flashcards or a UWorld journal. If you haven't heard of a UWorld journal, I'll try to put some links in the chat to tell you how to make one. And then you need your like active learning sort of memorization tools. And so something like Sketchy. And I'm going to say it straight up. I know I'm not affiliated with Sketchy, but I'm here on Sketchy webinar. Incorporate Sketchy into your teaching as well, because it provides that nice complement to the very word heavy aspects of those other resources with a very pictorial heavy. So the whole idea is that you're hitting all of your different modalities of learning: words, talking out loud, spaced repetition, using images for the visual learners. So once you have all that, spend your first, say, 10% of your study time working on that and building that foundation, and figure out what are the resources that work for you. Not everything works for everyone. So try out a couple and figure out what works best for you. Then you hit your actual, what I call sort of the dedicated or the focus time. For step one, this could be multiple weeks. For step two, this could be multiple weeks. For your shelf exams, this could just be like 2 weeks or 4 weeks. It can be pretty quick. But the general framework still exists, where your structured review, just like the blue arrow here, is going to go down over time. So what I mean by that is maybe the first week you're going to review your encyclopedia and read it, word for word, skim the entire encyclopedia, step up to medicine, first aid, what have you. But as you get closer to exam day, you're going to want to do less of that and really focus just on the subjects that you feel weak on. And the way to figure that out is ask yourself, what do I not want to see on test day? And whatever you don't want to see on test day, that's what you should review as you get closer to the exam. And then the opposite of that is, as you go through your clerkship or your dedicated study period, you want to increase the number of questions. For some clerkships like surgery, you may start off with only being able to do 5 questions a day, but you want to increase that 10, 20, maybe even get to 30 or 40 by the end of the shelf, like the week before the shelf. Other clerkships where you have more time, you can start off a little bit heavier on questions, but the general premise kind of continues, where you're going to increase the amount of questions you do over time. We had a bunch of questions that just came through in the chat. I'm going to try to answer a couple of them really quick. One was about that blueprint question bank. The blueprint step one exam. I think it's a compliment to UWorld. I think UWorld is a really good tool. I encourage all of my students to use UWorld, but frankly, it's also nice to complement that with alternative testing banks so that you don't just get used to the format of one testing bank. You can kind of jump between them. And that could be Amboss, it can be, Roche Review or /Blueprint, it could even be Kaplan. But that way you just get a little bit of variability as you approach these testing questions. Awesome.
Okay, great. So I'm going to jump in to talk a little bit about my clinical experience. But for me to do that, I want to set the stage. So at Columbia, we actually get a 2-month dedicated period for step one. We don't get any dedicated for step two in our clinical year, and therefore our shelf exams actually happen before step one. So what this meant for me was that my clinical year and the shelf exams were almost like a dress rehearsal for step prep and an opportunity to figure out what worked for me. In terms of pain points that I identified during my clinical year, honestly, the biggest one, and I'm sure a lot of you that have either gone through your clinical year or have either been oriented to what it's going to look like, can probably identify with these, but the biggest one is time management. So realistically, you're spending anywhere between like 12 to 14-hour days, especially on some of those intense rotations in the hospital. And then the bulk of my time outside of the rotations was actually spent dedicated to clinical prep. So for example, writing notes, documentation, preparing presentations, or reading articles to prepare for getting pimped on the wards. That realistically would leave me with a lot of time to actually dedicate to preparing for shelf exams. Another big pain point that I don't think a lot of people talk about, and it's really unfortunate that we haven't really come up with a great solution for this, is actually identifying and acquiring high yield resources for each rotation. So as I'm sure you're aware, for at least at Columbia, we had a shared group and we would all talk about, at least from the years above us, they would share like, okay, use case files for this rotation and blueprints for this rotation, first aid for this one, BRS for that one. This ultimately led to me and a lot of my classmates paying way too much money and feeling extremely overwhelmed because we were owning anywhere between like 3 to 5 resources for each individual rotation. Also, something that was a pain point for me was a lot of the time when you're on the wards, attendings will tell you what they do in practice, but that can really be different from what you're expected to know for the boards. And I wish there was really this like one-stop shop for what do I need to know for the wards and what do I realistically need to know for the boards. What did work for me during my clinical year was, I know Camden talked a lot about what tools can be really useful for learning, and I totally echo all of that. I also, in terms of just when I was in the hospital, try to seek out a diversity in your cases. So be an advocate for yourself. When I was on my IM rotation, I would be like, hey, I already saw a cards case. I want to see a poem case, now I've done that. Can I see something in the GI so that I can get some familiarity with that? Because a lot of your learning for the shelf exams will happen like through your cases and through the assessments and plans that you're creating for each of your patients. So you really want to make sure that you're seeking out that diversity. Also, having a pocket handbook in my white coat, I know that, it's not super great because it is also very manual of a process. You have to flip through it. But for me, when I was especially getting pimped or right after rounds, I would look up something I didn't know and just flip to that section, and I would be able to see all of this information that I needed for that specific, topic. But yeah, I'm actually gonna, before I talk a little bit about the step exams and what worked for me there, I'm gonna actually hand it back to Jin for a second.
Yeah, so this is hot off the presses. We actually worked with our clinical ambassadors and then also our medical experts in-house to create this one-stop shop for if you are upcoming rotations in psych, peds, family med, or neuro. We created these 101 guides of general principles, high yield tips, what do you expect when you come into this rotation, and a lot of templates and examples of how to present as a clinical student. So we're super excited about this. This was essentially a guide our clinical students who are M3s and M4s and residents wish they had before they got into the rotation. So definitely give those a check out if you just finished your step 1 or about to and gonna have upcoming rotations. I'll definitely post a link in the chat so everyone can get access to that, but brief call out there. Back to you.
That's awesome. Those are going to be huge resources because then you just pull them out and you've got them right there.
Yeah, definitely. I really wish that I had these when I was going through my clinical year. Yeah, so I'm going to go into now that I've set the stage and I've sort of explained my general experience at Columbia, I wanted to talk a little bit specifically about STEP. I know we have a lot of people that are clearly taking step 1 either very soon in the next week or in the future. But ultimately the goal during my step one dedicated, and we had a very hands-on administration. So they actually created a guideline for us in terms of sort of that planner that Camden had talked about, that Blueprint has, but they outlined, okay, we should be going through, this organ system this week, and we should be going through this many questions this day. But typically what that looked like for me was that I had to get through 80-year-old questions a day with 1 day off a week. I also, sort of the schedule that they had outlined for us was working 3-hour blocks with 1 to 2 hour breaks between each of those blocks. And I was simultaneously juggling first aid, UWorld, which was my question bank of choice, as well as SketchyMicro and SketchyPharm and Pathoma. I never was huge on Anki. I always thought it was kind of clunky, but I'm going to have some haters in the chat. People are going to be like, you don't know how to use Anki. But I made UWorld flashcards and Quizlet decks. My biggest pain points here were learning how to do UWorld in real time, kind of like what I alluded to during my clinical year, and kind of what Camden said as well. There might be some days where you're not being able to hit as many questions as you can. Ultimately, the goal is to gear up in the number of questions you're doing during that rotation. But for me, I did feel that one of my biggest pain points was learning how to do those questions. And then also with time management, not falling behind, feeling well rested, and riding the high of those break days and evenings that you're supposed to be giving yourself to keep me going. So all of that being said, some tips and tricks, figuring out what works for you early. So if you are well before step one, this is great. This is actually an opportunity, or step two, this is an opportunity for you to just really figure out how to get through question banks and how to get through hitting those targets every day. For me, I did find, for example, using the Pomodoro technique really helped to break apart those 3-hour blocks. So basically I would have a YouTube video playing of someone else studying, 25 minutes studying, 5-minute break. Also getting into a rhythm with UWorld questions beforehand. A lot of my classmates and I were talking about how the first couple weeks of our dedicated, we were barely hitting 50 questions a day, because you do realize very quickly that once you're trying to balance that alongside all of the other tools, like the retention tools, and also just like learning everything sometimes for the first time, it can get very hard to hit those 80 questions. So learn how to approach a question stem. And what I mean by this is something that works well is being able to read the last line of a question, using that as a guide for what is it that I'm looking at or looking for, then going into the answer choices, and from those answer choices, using that as a tool to decide what sort of buzzwords or what sort of facts am I looking for from that question stem that will either help me rule out or rule in these answer choices. And that really helps you sort of navigate that question so that you're looking at it through a different lens, and a very almost like tunnel vision lens. I think other than that, just also getting very familiar with timed, untimed, and tutor mode in UWorld. And please take breaks, the hours and the days off seriously, regardless of whether you're doing step one dedicated or preparing for step two. Just make sure that if you're setting time to take time off, then really take that religiously, get away from your resources, go hang out with your friends, and be very kind to yourself during this whole process, because it is a very stressful process. And ultimately, just remember you're a student and this is just an exam. So yeah.
That's a huge point, that last part you just said, Pooja. And I want to emphasize this because I don't think I emphasized it earlier, is, and I said this in the chat, this is a marathon, not a sprint. I'm not a big runner, but I don't know any marathon runner that runs every single day a marathon and then expects to do well on race day. You're going to get shin splints, you're going to get all sorts of fatigue, burnout, plateau. That's not how you get to your potential. Everything needs a break. And that includes you and your brain. So definitely, the rule of thumb is try to take 1 day off a week. If you can't, for some reason, you can't take 1 day off a week, take half a day where you go out and you do something any day, and just make sure you do that, because it's important for the mental health. It's important for helping you do better, and it's important for your physical health. So keep that up.
I'm going to
sorry.
Camden, sorry. I'm just going to answer. I think Gabriel, you posted for UWorld, would you recommend doing random questions or tailoring the selection to topics you're currently reviewing? at Columbia, and Camden can also talk a little bit about this, but we were told do 80% of your questions, sort of keeping 80% of your questions where you're going system by system during that week when you're reviewing them, and then leaving 20% to create like random 40 question blocks so that you're getting an opportunity to also just get almost like a actual like test simulated experience where, you know, you're obviously not going to be told this is a cardiology question. So that really helped for me. So yeah, definitely reserve some questions for random. Yeah.
That's a super good point. And actually, we kind of illustrated on this slide, which is how do you create your study plan? So again, I already talked about, you know, one resource, which is that med school study planner that basically assigns you the page numbers. And it's basically a checklist for every single day, gives you an idea about how long it should take you to get through that material. Alternatively, you can just use a good old Google Calendar. So this is an example of one that I would have created for my students, and I still create for my students, where it's pretty detailed. I give the number of pages, and you know, I say, hey, these are the sketches that you need to get through today, and then here's about how long, you know, you should do a UWorld block. And importantly, you say, is it timed? Is it tutor? Is it unused questions, incorrects? That's a lot of words coming at you, I know. But the thing that is that once you complete this Sketchy Micro review, immediately you go into active recall. Now you're actually testing yourself on the material. So to get back to the question, I think tackling material in a subject-based manner, particularly in the first half of your dedicated period, is really important. Because otherwise you're getting a question about repro and you haven't thought about repro for a year and a half. Like, you're not really learning. The idea of using these test blocks is to help you put the information you just learned from Sketchy or first aid into practice. Later on, you're going to start going to timed mode, to kind of challenging yourself to get through all 40 questions that are completely random from all sorts of different blocks. And so I think that 80-20 rule that Pooja said is a really good one to kind of, you know, keep in mind. 80% tutor mode, subject-based, 20% timed, full random. Okay. I don't know if anyone else is excited about questions, but I am. So this is an example step one question, step one style. And I know we're going to have people already putting answers in the chat. The goal here is not only do we want to get through these questions, I want to talk about how you approach these questions. If you ask 10 people how to approach questions, you're probably going to get 10 different answers. So as always, find what works for you. What I'm going to talk about is the method that I've found works for really the vast majority of students. And the very first thing that you do in that scenario is, I mean, there's a lot of information in these step one questions. There's lab values, there's a whole vignette, then there's actually the question, then you have your answer choices. So where do you begin? What you want to do is you want to start out here. Read the question out loud to yourself, even if you're, you know, at home studying. Which of the following is most likely associated with the pathogenesis of this patient's condition? Okay, so I know this is a second order question. I'm going to have to diagnose the patient and then think about the pathophysiology of that diagnosis. The next thing to do is look for the answer choices. Very, very briefly. The only reason you do this is not to try to pick an answer choice right now. It's to ask yourself, what system am I working with? Is this like a biochem question? Is this a cardio question? Is this like a pharmacology question? And that's important because then it helps you differential as you build it, as you think about this patient, you know, as if you were walking into the room with them. You want to think about what categories of illness you're looking at. And so when you're doing a full random testing block, this could really be on any subject. And so you want to skim the answers real quick. And when I look at this, I start to think, I'm seeing heme, I'm seeing globin. This is probably something about anemia. So I put my anemia brain on that. Then you go back through the vignette. And when you approach question vignettes, you want to distill each sentence down into its facts. Let me kind of demonstrate, and then, you know, everyone can practice on the next question as well. So a 36-year-old woman comes to the clinic for a routine checkup prior to traveling abroad to live with her extended family in Greece. All the information that the MBME or UWorld or Roche Review or any other test bank gives you is important. She's not elderly, she's not pediatric. She's an adult, you know, a young adult woman or middle-aged adult woman. She comes to the clinic for a routine checkup. She's not going to the ER. This is not really an emergent pathology. She's going to the clinic. So we're thinking something that's not going to, kill her today. Then you say she's traveling abroad to live with her extended family in Greece. In the chat, what do people think when they see that in an anemia context? I won't say it yet, but I'm underlying sort of the facts that they're giving us. Great, I love it. I'm seeing some thalassemia thoughts. Perfect. Mediterranean descent. Actually, I really like that one because we don't necessarily want to anchor to thalassemia right now. We want to think genetics. We want to think Mediterranean descent because that starts putting on, okay, what diseases are associated with those populations? Nice. She feels well and has no complaints. Okay, good. She's not sick. And you're looking at her. This is a patient that you would say when you walk into the room, not sick, instead of a patient that you say is sick. She frequents the gym regularly. She's strictly vegetarian. Why am I underlying vegetarian in the context of anemia? Why do we kind of care about nutritional status? There's all sorts of, folate, you got iron, you've got B12 deficiency. A lot of vegetarians have very full diets that have a lot of good things, but B12 is one that we typically are concerned about. But then in the next sentence, she takes iron, she takes folate, and she takes, what is cobalamin? Oh, cool. I can never say that word out loud. It's vitamin B12. Routine labs are drawn in hemoglobin of 11.2 and an MCV is 65. What is our normal MCV? And what is our normal hemoglobin in an adult woman? You guys are brilliant. This is awesome. Yeah, 80 to 100. Great work. I'm taking my time on this because I really want to break it down how you think about these questions for when you get to harder ones. So if we were to distill the facts from this, we're basically saying which of the following is most likely associated with microcytic anemia, potentially with some sort of genetic factor. Again, we aren't thinking nutritional because they kind of rule that out because she's on all these nutritional substances. So we're not thinking macrocytic picture. We're not really thinking iron deficiency, nothing about blood loss. So we're not really thinking iron deficiency. We're thinking about, as someone said earlier, the thalassemias. So I'm already seeing answers come in. Which of these now, we can rephrase the question, is most likely associated with thalassemia? Accumulation of iron granules? No. Issues in DNA synthesis, that's usually macrocytic. Heme synthesis, remember, microcytic is either problems with globin synthesis or heme synthesis. This is not a heme synthesis problem. That would be like lead or iron deficiency. This is a globin synthesis problem. And then chronic intrinsic hemolysis, that's going to be a hemolytic anemia, which is going to be a normocytic anemia. The way I like to always categorize it is microcytic, there's not enough jelly in the donut, meaning that if our donut's our red blood cell, there's not enough globin or heme. Macrocytic is always problems with like DNA synthesis. So I think about nutritional things like folate and B12 that are critical to produce our red blood cells. And they're macrocytic because blood cells get smaller as they get older. And so I think like it's like these baby DNA problemed red blood cells that are really big. And then our normocytic anemias typically are, there's a lot of different categories, but that's more problems with the red blood cell itself and hemolysis. So great. Everyone's right. Globin protein synthesis. Good work, folks.
Yeah, great job, everyone. I like the jelly in the donut analogy, Camden. I'm going to take this as like an opportunity to also give you guys sort of a glimpse into sketches that if you had seen certain symbols may have helped you recall this information. So there we have a overview of microcytic anemia, a differential video. And I'm just going to highlight here, as you notice that, when you hear the buzzword Greece, a lot of people said Mediterranean descent. If you remembered the map from this video, you would be able to see that we actually have a beta on top of the Mediterranean region. That would have helped you recall like beta thalassemia and sort of allowed you to think about that. Also, all the way in the back, you'll see that watering can. It has a spout and a handle as well as an 8 on it, just to sort of visualize less than 80 to remind you MCV less than 80 for microcytic anemias. And next to it, we have all of those small red flowers, also as just a little bit of a reminder that these are microcytic red blood cells. So I'm going to hand it back over to Camden to look over the step 2 question.
Definitely. What do people notice about this question versus the last one? For anyone taking step 2, this probably rings clear, which is that there's even more information. There's going to be a lot of information for step 2 questions. I'm going to give you labs. Sometimes they even give you like an H&P style format, where they, chief complaint, name, age, and that's how you have to work through the question. And so you need to be very good at practicing working through these vignettes that are long in a standardized way so that you can be efficient. So again, just like before, which of the following is the most likely diagnosis? Oh, I love these questions because it's just like play doctor. Like this is why this is one of the fun parts of medicine, is just solving the problem. And then we look through here and we say, okay, it's something that is GI related, hepatobiliary problem. Okay. So let's get the facts. I usually save labs for the end to either rule in or rule out my differential diagnoses on my differential. 65-year-old man, so older, history of CAD, presents to the ER. He's not presenting to an outpatient clinic. He's presenting to the ER with sudden, so acute onset abdominal pain. So we're thinking acute pathologies. He reports the pain began suddenly while eating and is unremitting. So it happened out of nowhere while he was eating, and it's not going away. It's not episodic, it's unremitting. Sublingual nitroglycerin has not relieved the pain, okay? So probably not really, cardiac here. Current medications are lisinopril, nitroglycerin, metoprolol, aspirin, hydrochlorothiazide. So he's, kind of an average 65-year-old male in most of our vignettes. He's on a variety of different kind of vascular, cardiac and medications. His temperature is fine, blood pressure is fine, heart rate is fine, respiratory rate is fine. Physical exam reveals severe. Always look for the adjectives they use. Right upper quadrant tenderness and decreased bowel sounds. What does decreased bowel sounds mean to people? What do you think about when you think about that? Just anything. There's no right answer, no wrong answer. Just what's your differential? Getting some constipation, bowel stasis. I like bowel stasis. Ischemic, yeah. Serum labs are shown at the right. Ultrasound is significant for intra and extrahepatic bile duct dilation. Someone in the chat, tell me what they think about when they think about this. Like, what does that mean? What is that fact? And while you're doing that, I'll talk about the labs. Elevated total bilirubin, elevated direct bilirubin, normal LFTs, or AST and ALT, elevated alk phos, and normal pancreatic. So I want to take a second here. Everyone's got great things coming through on the chat. And tell me a little bit about what your thoughts are here. Like, what are you thinking about when you look at bilirubin, for example? Like, why is our bilirubin elevated? And specifically, what does the direct bilirubin being elevated mean to you? Conjugated, good. Yeah, exactly. Yeah, we're able to conjugate our bilirubin. So that means that where does conjugation occur? It occurs in our liver with an enzyme that I can never pronounce, so I'm not even going to try. It's like guanosinyl transferase or something like that, and it conjugates our bilirubin. And so we know that if we've elevated direct bilirubin, the problem is post-hepatic. There's something downstream of the liver that's backing up our bilirubin because we're able to, conjugate it just fine, but then it gets stopped. And that's great because that is consistent with our AST and ALT elevation, where now we have fine liver function, but something is blocking it, an obstruction down the line. Why is our alk phos elevated? It's kind of a read my mind question. It's very silly. Anytime you have hepatobiliary, alk phos is going to typically be elevated. Great. And we know it's not pancreatic because we have normal amylase and lipase. So that allows us to use the facts of the vignette to say, well, labs say it can't be pancreatitis. Maybe it's pancreatic cancer. Maybe it's common bile duct stricture. Maybe it's cholecystitis, choledocholithiasis. Why don't we like B? A lot of reasons. One that sticks out to me is itis. When I think about itis, I think of inflammation. I'm going to think that this is going to be someone with a more infectious pathology. They have an infected stone in their gallbladder. That's what cholecystitis is. Colodocolithiasis. This is where we actually have a stone got squeezed out of the gallbladder, working its way down the common bile duct, and it gets stuck. Well, that seems to be pretty congruent with all the evidence that we get here, which is that we have a post-hepatic obstruction in our biliary tree, leading to a direct bilirubin elevation. It happened while we're eating. Remember, when we eat, our gallbladder is going to contract. So what probably happened is our gallbladder contracted, shot that little stone out, and it got partway down the tract, but then got stuck. And so now it's unremitting. If it was still in the gallbladder, it could be more episodic. Pancreatic cancer, maybe, but pancreatic cancer is not going to be sudden. That's going to be a slow constriction of that obstruction of the biliary tree. And so it's going to be a kind of more of a chronic picture that we're getting. Also, you're right. We had some comments in the chat saying, also, you probably expect maybe some disruption in the pancreatic enzymes. Potentially, yeah, you could have that. Common bile duct stricture, again, that's going to be something more of a picture of someone who has a chronic condition. Wow, that was good. That was a lot of questions and a lot of great work in the chat as well, folks. We're trying our animations here. There we go.
Oh. Nice.
Yeah, so same as the first question. Thanks, Camden. I'm going to show you guys a sketch that we have for colodocolithiasis. So it's a bocce ball court. And if you were to review the sketch, you would be able to recognize certain symbols that could point you to the correct answer choice. You'll notice our statue here is sort of clutching at her right upper quadrant in pain because she's experiencing some right upper quadrant tenderness. You'll also notice that we have our referee here holding our, the recurring symbol for ultrasound here at Sketchy is sort of like a megaphone or a bullhorn. So he's holding up that bullhorn, and next to it, you'll see sort of dilation of the bile duct. That's symbolized by dilation of the cord here on the side. Also, in terms of sort of the enzyme, the pattern that we saw, we have this chalkboard. So kind of a, chalk, ALK, elevated alkaline phosphatase, but also we have on the chalkboard, you can see cholestatic pattern of the elevations. And then you'll also notice our yellow elevated bilirubin goat. So that should also make you think of, an obstruction leading to elevated bilirubin, which is leading to the jaundice. But yeah, I'll hand it back over to Camden for our last question.
Definitely. And hey, everyone, I know I'm going through these questions pretty fast. So if you have any questions, please put them in the chat. And then earlier on, I also put my own contact information for Blueprint as well. So you can always feel free to reach out with any questions that you have. So this is a shelf style question. And I wrote this one a little bit differently so that it more mimics how the shelf exams are, which is typically shorter. They're kind of a little bit more brief, a little bit less information in general. And so for anyone out there who's on their clerkships, this is more similar to what you'll see. Our approach still stands the same. What is the most common complication related to this condition, to this ingestion? Okay, so we have to figure out what he ingests and then think about what's the common complication. Something to do with, this could really be cardiopulmonary. This is kind of a very broad collection of answer choices. 55-year-old man, so middle age, history of hypertension, okay. He has an altered mental status, and again, emergency department. This is an acute problem. His spouse reports find him confused and lethargic at home. The patient reports no recent illnesses, but reports accidentally taking extra doses of his prescribed beta blocker medication. Okay, so we can rephrase this entire question. We can say, which of the following is the most common complication related to beta blocker overdose? Now our answer gets a lot easier. So what are people thinking? Awesome. We're getting a lot of A's. Yeah. So I agree. I think it's bradycardia because, this is what, beta blockers slow down our heart rate. Let's say this patient's taking metoprolol. So metoprolol, it's going to decrease your heart rate. It's also going to decrease your blood pressure. And the primary thing that it does is decrease your blood pressure, but it can also, slow down our heart rate as well. That said, we have to think about some of these other answer choices. So seizure, I mean, I've never really heard of a beta blocker causing that. I think if you probably take anything in enough doses, it can cause a seizure. But again, it's not the most common. You have to pay attention to these terms, like when they say most common or most likely. Bronchospasm. This is a cool one because a bronchospasm, you could say, okay, beta blockers, they're going to prevent sort of that dilation of our bronchioles. So it could lead to a bronchospasm. But then you have to think about bronchospasm means our bronchi are spasming, not that we're preventing them from kind of opening up. That's a little bit of a nuance, but then the second thing you can ask yourself is this the most common? No. I do like what Achal said, if he's taking non-cardioselective beta blocker, then maybe bronchospasms. I agree, but it's not the most common. The most common that we'd expect is bradycardia. And then hyperglycemia, no, actually, beta blocker intoxication, I believe, is more associated with hypoglycemia.
Thanks, Camden. Yeah, so for that final question, we also have a beta blocker sketch here at Sketchy that if you had seen, you would be able to recognize that most common complication of bradycardia. One of the recurring symbols here is also a heart watch that we use. Either it's raised, someone could be wearing a watch on their hand to represent tachy, or it's sort of hanging below, which represents brady. And in this case, you'll notice that our piano player here has a heart watch hanging out of the back of his back pocket. So that would have reminded you of bradycardia. Yeah, thanks for going through the questions with us, guys. And thanks, Camden. That was a great overview.
Yeah, well, before we get to this, why don't we give the last few questions that came in? It may have been regarding some of the questions you guys walked through or just general boards tips. Let's just get a kind of a little ad hoc Q&A section here before we dive into the sale, the discount, and the giveaway at the end.
Definitely. I was answering, we've had a lot of great questions in the question and answer chat. So if you did ask a question there, I think we've answered about 14 of them. But definitely ask any kind of general questions that you have about studying right now. And Pooja, if you see any good ones to answer, we can start going through them.
Yeah.
Well, I see one from Christian that was here for a while. Should he go through lectures first and then UWorld? For example, go through cardio and then UWorld blocks for cardio.
That's a great question. So if I'm hearing you correct, it's like on the same day sort of thing, like, which do you go first? You go through the memory, the information learning part, so lectures, and then do questions, or vice versa. And there's pros to both. In short, I would say for probably 70% of people I've worked with, it's better to do the content review first and then directly apply it. What I would do though is early on in your studies, I don't know where you are as you're preparing, but early on in your studies, try both methods and see which works better for you. What could work the best is to do, say, let's say you have 3 days that you're reviewing cardio. The first day, do content review and then questions. The second day, do content review and then questions. And then the third day, do questions and then finish up your content review. So you kind of can mix and match a little bit of both. Because if you do questions right off the bat the first day, it could just be, a bunch of pharmacology that you won't even get to the final day. So it won't really get you, it'll be maybe more demoralizing than it will be helpful.
Amazing. Thank you, Camden.
Oh, we had a
Yeah,
good one
thanks.
here. How do you review UWorld questions answers faster? That's a great question. It's hard to give you guys a very general framework. And Pooja, let me know if you have kind of seen different numbers, but typically for step 1, 40 question UWorld block, you should aim to review it in about 4 hours. For step 2, where typically folks study a lot more, like do a lot more questions, it's a lot more question heavy studying. And for shelf exams, typically half that. Usually it's twice as fast for the review during that period. That's a good starting point. The way to review them faster is check out that blog link I said about the UWorld journal, but then you almost have to just like put a timer, do the Pomodoro technique, say, I've got 5 minutes to review this, and just read through it all and focus on the material that you needed to know to get the question right, not all the other answer choices. Really focus on what it was that got you to the right answer.
Yeah, echoing mainly pretty much everything. I think in terms of my dedicated, I was shooting for 30 to 40 questions every like 3-hour block, 3 to 4 hour block. So however that works for you, I'd say I did see someone asked a similar question in Q&A. Yeah, in terms of reviewing the answer choices, this is something that initially I was struggling a lot with to meet those numbers, but I think once you sort of take a very like you have to take a sort of making sure you're just taking away the high yield information. So take away the educational objective and review the answer choices at the very least for the ones that you could not confidently rule out, so that you can at least walk away with that knowledge. That would be my suggestion if you're struggling to meet that like 80 questions and reviewing those questions every day.
Great. We have,
Let's see.
this
There's
might be an
sorry.
interesting one. Um, Students who are, postgraduate, this is a second-year resident, working a ton of hours. They only have 1 to 2 hours a day to study. What's the recommendation? How should they optimize those 1 to 2 hours?
Yeah. So and there was actually a similar question that was in the question and answer chat. So I've worked with a couple of students in these positions, and it's hard. You're balancing family, you're balancing life, you're balancing the stressors of having basically a full-time or double full-time job. And I think one of the things you have to do is you have to manage your expectations, first of all, and you have to have a longer time window. If you're a M2 student dealing with step 1 and you're in dedicated, that's all you have. Like that's what you're focusing on. And so you can do it in 6, 8, 10 weeks. But if you are in this person's position, you need to expand your horizon a little bit and say like, okay, I can only work 1 to 2 hours a week, or a day. What can I accomplish in that time? I would emphasize the same strategy we said before is that's going to be on sort of a micro scale. Say 1 hour is going to be spent content review, 1 hour questions, and then just double or triple the amount of time you think that you're going to need in order to actually sit for the exam. So if you had no other commitments and you say 4 weeks is all I need, well, now that you have all these other commitments, you can say, well, maybe I should actually prepare for like 12 weeks or 16 weeks and just be able to do 1 or 2 hours a day. And that goes particularly for those of us that also have kids, or a job or whatnot. Is you have to be willing to extend your timeline or lower your expectations, which is fine, if you also are trying to balance all these commitments. And the most important thing is that you do balance them. This is not the end all be all. You need to also balance your life as well as much as you're able to.
Amazing answer. Let's see. Sunny has, how do you review your UWorld questions? Handwriting notes, short buzzwords?
Yeah, that's a great question, Sunny. I think honestly, for me, and this is what I was talking about a little bit earlier, is you really have to optimize your UWorld review strategy. So again, making sure that you're absorbing that educational objective, because that's what UWorld really wants you to walk away with from that question stem, but also going in and the way Camden was approaching the questions, you read the last line, you then go through the answer choices, and then you go back to the question stem. So if there was at any point you were unable to confidently rule out an answer choice, I would also review UWorld's little blurb on explanation on why that answer choice was wrong. That really helped me sort of bring down that time that I was spending reviewing UWorld. I would also sort of, someone else asked, how do you incorporate first aid? Basically, exactly to what Camden was saying, I treated it like an encyclopedia. So I would actually annotate first aid as I was going through UWorld review. So I would find that topic for that question. I would, see that section first aid, and then I would either highlight what parts I felt were high yield, or I would add to it directly what I felt like maybe it was missing. And that really helped me sort of almost integrate first aid into my UWorld review.
Totally. And the other thing you can do, and I've mentioned the UWorld journal before, the question bank journal, but the premise of that is after you complete the question, read through the answers, just read it. Don't take any notes or anything. Just read through the explanation and then ask yourself, what was the one fact that you needed to know, you personally, in order to get that question right? And that's what you make a flashcard for. That's really all I did. That's what I encourage my students to do, is literally, if, the anemia question that we had earlier could be, Mediterranean descent is associated with what type of anemia? That's that's the factoid that you needed to know to get the question right. And so then, your answer to that on the other side of the flashcard would just be, thalassemia, beta globin, or sorry, globin chain synthesis. And so that allows you to really distill down all that information into one fact. And there's like 3,000 UWorld questions. So that's like 3,000 flashcards by the time you're done.
Perfect. Well, we are coming up on time with 3 minutes till the hour. So I want to make sure that we do our quick plug for our discount to Sketchy. For those who, I think it was like about 20% of you guys are new to Sketchy. So if you do want to get us and our sketches for upcoming boards, definitely take advantage of the 15% off. This link is unique for new accounts, or if you had a paid account previously, but it has expired. So for renewals, it will work. This link is going to be live for the next 2 days. So it will expire on the 4th at midnight. We'll also reshare this out in the post-event email, so you can have it in your inbox. But definitely take advantage if you, had a expired paid account and want to renew for a short extension, 1 or 3 months. That is available for you as well. So definitely take advantage. And then our exciting giveaway and raffle, we can get right into it. I think it's the next slide there. So that is for the 2-hour blueprint tutor session. So if you really enjoyed what Camden just went through just now, this is going to be amazing. And I believe you guys have sessions that can be purchased, right? If they like that. Okay, perfect. Yeah. So if this is your type of learning style, study style, definitely recommend Blueprint there. And then also the lucky winner will also win. Oh, I did mention three months earlier, but it is 6-month Sketchy Medical subscription. So what I have in front of me is a export of the intro poll of everyone who answered that. And then I also have a random number generator here on Google. There's 279 of you guys, so I'm going to randomly generate a number, and whichever one that lands on, you will be the winner. So 153. So let's go and grab that, and let's see. So this is Alexis Samples. So if you are Alexis Samples, give us a shout in the chat, and we will email you. But I want to make sure you're still with us, because we did see some folks drop off.
Hopefully we have better luck this time. I think a couple of webinars ago, we kept choosing names of folks that had just dropped off.
And it seems like Alexis might have. I don't see her.
Oh no, Alexis.
Yeah. I'll give you 3 more seconds and I'll choose someone else. Hopefully I get you, Jared. All right, I will generate another person. I'm sorry, Alexis. All right, 227. So let's see, who is our 227th response? David Manser. David.
Drum roll.
Oh, there you
Oh,
go.
he's here.
Congratulations, David. Thanks for joining and sticking with us till the end. And yeah, super lucky. Probably a lot of folks are jealous of you right now. But we will be reaching out to you both Blueprint and Sketchy individually with your free session and also subscription. So stay tuned for that. But thank you so much for joining us. We will have many more of these in the future. We're hoping to, say hi and provide value add content during our webinars. So thanks so much. We will catch you next time. Thank you, Camden. Thank you, Pooja, for joining.
Good work, everyone.
Good luck to anyone taking
Yeah.
it.
Best of luck, everyone. Bye-bye.